morning. When was the last time you had a doctor's visit? And how long did that consultation last? And how many seconds did you feel you were truly seen? And for most people, the answer is about 7 minutes. Yes, 7 minutes for you to talk about your fears, your pain, and your story. For doctors, those 7 minutes to actually write the notes, prepare a prescription, and move on. What is missing is a true sense of human connection. Now, let me be very clear. This is not because doctors don't care. It's because we are in a system that makes time scarce, that appreciates and rewards efficiency over presence. Now, I remember me taking my mother to a clinician. She was very anxious, full of questions, and hoping for reassurance. The doctor was very diligent, took in all the history, all the reports, was preparing the notes, and gave us the best possible prescription without anything being missed. We walked out with the best medications. But what was missing was that human sense of feeling connected. And then I truly felt that day, if my own family felt that we were unseen in the consultation, what about everybody else? That day stayed with me. When I was in school, I dreamed of becoming a doctor. Not because I was fascinated by diseases, but because I believed medicine is about people, about listening, about guiding them, and about truly caring. And when I started to practice, I found myself sitting in front of the screens and staring into the screens more than looking into people's eyes. And I started to ask myself, am I truly missing the sense of human connectivity? Is this what I'm prepared to do? And then it hit something very hard to me. And then something truly unexpected hit me to find my purpose back again, which is technology. Yes, the very thing that seemed to take us all away from our patients can actually bring us back to them, can actually help us allow us to do a lot of things. That became a seed for PMX Health. Yes, at PMX Health, we design technology to do all the background work of collecting the health data, information, interpreting the patterns, and also identifying the early risk markers and flagging them out for you. And now, when I see a patient, I already know half of their story. And when they're already in front of me, I wouldn't start by asking, tell me what's wrong. I would in fact start by saying, here is what I noticed about your lifestyle data, about your sleep metrics, about your recent health records, and so on. And when I talk about this, instantly the consultation begins. The patients feel understood even before they actually started speaking. That is the power of technology. Let me share with you a few simple patient stories of my own patients. Number one, a very young student walked into my office fully exhausted with all the blood reports almost normal. And if any other doctor has looked at it, pressed with time, not because they had to, but they had to, would have prescribed a multivitamin. But when I looked at her, the data told much deeper stories about her sleep patterns, which last for less than 5 hours, her disrupted eating behavior, her multiple deficiencies, stress before going to exams, and a whole lot of it. And after looking into all of these, we didn't just give her a pill. We prepared a lifestyle and nutrition plan together that works just for her. And another story, a middle-aged man who is a diabetic and hypertensive has had many consultations in the past all about changing the dosages and all about changing the medications. But when he walked into my office, I looked at him as a whole. I found out he had high homocysteine levels, low metabolic scores, very less stress resilience, and high glucose variability on continuous glucose monitoring. And then we made small study changes, healthy behavioral changes, so that his lab biomarkers changed and also his confidence. For the very first time, he felt he had more control over his health. And then came a third client who is a very young uh, athlete, a female, who walked into office just for the preventive health check. No diseases, no symptoms. And we found out something which is a silent red flag sitting under her reports. Number one was insulin resistance, and two was low heart rate variability on her fitness tracker. If left unseen, she could have landed in diabetes and much more, but we identified the risk early, tried to intervene and reduce the risk of the disease. These are not just human stories. These are not just medical wins. These are human wins. These are the stories that tell us something there is much deeper to it, that health is not one size fits all. For far too long, medicine has been built on averages. It's built on average dose, average ranges, average individual. But we are not average. We are all unique. We are unique in our biology, we are unique in our genomics, lifestyle, and environment. That is where personalized medicine comes in. It's about looking into your data, looking into your story, your health goals, and designing a plan just for you. So that is the practice I believe in, and that is where my heart lies in, not population medicine, but personalized medicine. Today, we have everything from genomics to wearables to continuous health tracking. Instead of looking at disease in abstract, we can start viewing at an individual with complete uniqueness. And when a patient truly feels that the care is truly their own, something shifts. The healing begins. And when the healing begins, we can all feel that the health is not just possible, it is also personal. Now, here is what I want to tell you. We are not here to debate or choose between humanity and technology. We are here to design a healthcare system that works equally both for patients and for doctors. For patients to truly be heard, to truly be seen and cared for, and for doctors to be able to practice the medicine they have always dreamed of, and putting the things what matters most in front of them. So here is what I practice in, and here is what I believe in. The healing doesn't start with the data. The healing doesn't start with the prescription. Healing truly begins when they see that they are felt, when they are understood. The healing begins when they feel the trust has begun. That is the kind of practice I believe in. That is the kind of medicine I chose to practice, and it's personalized medicine. Thank you.